Question 1. Scenario-based. Implementing differential reinforcement. Lena in RBT is working with 7-year-old child Jake, who frequently engages in interrupting conversations to gain attention. The BBA recommends using differential reinforcement of alternative behavior (DRA) to address this. Which of the following would be the most effective way for Lena to implement DRA in this situation? A. Reinforce Jake only when he waits for pause in the conversation before speaking. B. Ignore Jake completely until he stops interrupting. C. Provide attention whenever Jake interrupts, so he learns conversations naturally. D. Remove Jake from the group whenever he interrupts to reduce the behavior. Answer A. Reinforce Jake only when he waits for a pause in the conversation before speaking. Explanation. Differential reinforcement of alternative behavior (DRA) involves reinforcing an appropriate alternative behavior while withholding reinforcement for the undesired behavior. In this case, in the repeals undesired behavior while waiting for a pause before speaking was alternative behavior. Lena should consistently reinforce Jake. Praise attention when he waits for a natural pause before speaking. B. Incorrect. Ignoring alone does not teach an alternative behavior. C. Incorrect. Providing attention for interrupting reinforces the undesired behavior. D. Incorrect. Removing Jake response cost does not teach an appropriate replacement behavior. DRA is an evidence-based strategy that helps increase socially appropriate behaviors while decreasing problem behaviors. Question 2. Skill acquisition, prompting and prompt fading. Which of the following scenarios best illustrates least to most prompting, a strategy used in teaching new skills? A. The instructor immediately provides a full physical prompt and gradually fades to a partial physical prompt over multiple sessions. B. The instructor waits for the learner to attempt the task independently before providing a minimal prompt, increasing prompt levels only if necessary. C. The instructor begins with a verbal cue, then moves to a gestural prompt and finally applies a physical prompt regardless of the learner's response. D. Instructor implements fixed sequence of prompts in every trial without adjusting based on the learner's ability. Answer B. The instructor waits for the learner to attempt the task independently before providing a minimal prompt, increasing prompt levels only if necessary. Explanation. Least to most prompting involves giving the least amount of assistance first, allowing the learner to attempt the task independently before gradually increasing the level of prompting if they do not respond correctly. This method helps promote independence and generalization of skills. A. Incorrect. This describes most least prompting where the highest level of support is given first and then faded over time. C. Incorrect. The systematic increase of prompt levels is not dependent on the learner's response, making it less effective for skill acquisition. D. Incorrect. Using fixed prompt sequence regardless of the learner's needs fails to consider the principle of fading prompts based on progress. According to applied analysis about best practices, least to most prompting is beneficial for learners who may develop prompt dependency as it encourages independent responding. Question 3. Scenario-based behavior reduction, extinction and differential reinforcement. Emily, a 7-year-old with autism, frequently screams when she wants attention from her teacher. In response, the teacher has typically given verbal reminders, such as, "Use your words," or "That's not how we ask." However, this behavior has persisted. The teacher consults an RBT who suggests an extinction procedure combined with differential reinforcement. Alternative behavior DRA. What is the most appropriate way for the teacher to implement this intervention? A. The teacher should ignore Emily's screaming completely even if it escalates and avoid providing any response at all. B. The teacher should continue to provide verbal reminders, but also provide reinforcement when Emily screams less frequently. C. The teacher should stop responding to the screaming behavior while simultaneously teaching and reinforcing an appropriate alternative, such as raising her hand. D. The teacher should respond to Emily when she screams quietly and gradually reinforce quieter screaming before eliminating it altogether. Answer C. The teacher should stop responding to the screaming behavior while simultaneously teaching and reinforcing an appropriate alternative, such as raising her hand. Explanation. Extinction procedures remove the reinforcement that previously maintained a behavior. In Emily's case, the screaming was likely reinforced by attention from the teacher. To properly implement extinction, the teacher must stop providing attention when screaming occurs. However, using extinction alone can lead to an extinction burst where behavior temporarily increases before decreasing. This is why differential reinforcement of alternative behavior is used. Instead of reinforcing screaming, the teacher provides attention only when Emily raises her hand. Functionally equivalent alternative behavior. A. Incorrect. While ignoring extinction is part of the strategy, failing to teach an alternative behavior can lead to frustration and increased problem behavior. B. Incorrect. If the teacher continues to respond to screaming even if it's with verbal reminder, the behavior is still reinforced. D. Incorrect. This describes differential reinforcement of low rates of behavior (DRL), which is not suitable for behaviors that need to be replaced, such as screaming for attention. According to BAC guidelines, proper behavior reduction strategies require identifying the function of the behavior and implementing both extinction and an appropriate reinforcement strategy to increase alternative, appropriate behaviors. Question 4. Measurement, continuous and discontinuous data collection during a session. RBT is collecting data on a child's hand flapping behavior. The behavior occurs frequently but in short bursts lasting only a few seconds at a time. The supervising EEA instructs the RBT to use momentary time sampling to track the behavior. Why might momentary time sampling be less effective method for measuring this behavior? Continuous measurement. A. Momentary time sampling can overestimate the frequency of behavior, leading to inaccurate conclusions about the behavior's occurrence. B. Momentary time sampling only reckons whether the behavior is occurring at a precise moment, meaning brief behaviors may go unrecorded. C. Momentary time sampling is more time-consuming than continuous measurement methods such as frequency recording. D. Momentary time sampling is the best method because it captures all instances of the behavior without requiring constant observation. Answer. B. Momentary time sampling only records whether the behavior is occurring at a precise moment, meaning brief behaviors may go unrecorded. Explanation. Momentary time sampling records whether the behavior is occurring at the exact moment the interval ends. This means that if a behavior occurs between intervals but stops before the OBT looks, it will not be recorded, leading to underestimation of high-frequency short duration, such as hand flapping. A. Incorrect. Momentary time sampling is more likely to underestimate rather than overestimate behavior. C. Incorrect. It is actually less time-consuming than continuous measurement, since the observer does not need to watch the behavior constantly. D. Incorrect. It does not capture all instances of the behavior, making it poor choice for behaviors that are brief or sporadic. According to best practices, momentary time sampling is most effective for long-duration behaviors, while frequency recording or partial interval recording would be better suited for short bursts of behavior. Question 5. Skill acquisition, task analysis, and chaining. An RET is teaching a child with autism how to wash their hands using backward chaining. The child has difficulty with multiple steps in the process. Which of the following best describes how backward chaining should be implemented? A. The OBT fully assists with the last step while encouraging the child to complete the first steps independently. B. The OBT provides full assistance with all steps of hand washing and gradually reduces prompting across all steps simultaneously. C. The OBT assists with all steps except the last one, allowing the child to complete the final step independently before gradually working backward through the sequence. D. The OBT uses verbal prompt to guide the child through the process and reinforces attempts at any step of hand washing. Answer. C. The OBT assists with all steps except the last one, allowing the child to complete the final step independently before gradually working backward through the sequence. Explanation. Backward chaining involves fully prompting all steps except the last, which the learner completes independently. Once mastery of the last step is achieved, the second to last step is introduced for independent completion, and so on until the entire sequence completed independently. A. Incorrect. The child should not complete the first steps independently first. They should begin with the last step. B. Incorrect. This describes total task chaining, not backward chaining. D. Incorrect. While verbal prompting can be helpful, backward chaining involves structured step-by-step teaching rather than general reinforcement. Chaining procedures are critical for teaching complex skills and are commonly used in applied behavior analysis therapy. Question 6. Behavior reduction, extinction, and escape maintained behavior. Michael, a 10-year-old student with autism, frequently leaves his seat and walks out of the classroom when given a difficult math worksheet. His teacher usually allows him to take A break after he elopes. E determines that Michael's behavior is escape maintained and recommends an extinction procedure. Which extinction strategy would be most appropriate for addressing Michael's behavior? A. The teacher should physically guide Michael back to his seat and require him to complete the worksheet before accessing break. B. The teacher should prevent Michael from leaving his seat by physically blocking the door and ignoring his behavior. C. The teacher should continue giving breaks when Michael leaves his seat, but gradually reduce their frequency. D. The teacher should ensure that leaving the seat does not result in escape from the task while reinforcing staying seat at scheduled breaks. Answer. D. The teacher should ensure that leaving the seat does not result in escape from the task while reinforcing staying seated with scheduled breaks. Explanation. Extinction for escape maintained. Behavior involves removing the reinforcement that maintains the behavior. In this case, the unintended break Michael receives when he leaves his seat. A. Incorrect. Physically guiding Michael back could be aversive and lead to increased problem behavior rather than teaching replacement behavior. B. Incorrect. Blocking escape without an alternative strategy could lead to aggression or escalation. C. Incorrect. Allowing escape at reduced frequency still reinforces the behavior. More effective approach is differential reinforcement of alternative behavior drive, offering scheduled breaks for appropriate behavior rather than reinforcing escape. Question 7. Documentation and reporting, HIPAA and confidentiality. Which of the following would be a violation of HIPAA, Health Insurance Portability and Accountability Act for an RBT working in and about clinic? A. Discussing a client's behavior plan with the BEA during supervision meeting. B. Sending client's progress report via email to parent using an encrypted email system. C. Posting video of therapy session on social media without identifying information to share an about technique with other professionals. D. Recording session notes in an electronic medical records (EMR) system approved by the clinic. Answer. C. Posting a video of a therapy session on social media without identifying information to share an about technique with other professionals. Explanation. HIPAA strictly prohibits sharing any client-related information on public platforms, including social media, even if identifying details are removed. Video recordings of clients require written consent and should only be used in secure, approved settings. A. Incorrect. Discussing client progress with supervising EEA is permitted under HIPAA. B. Incorrect. Encrypted email systems meet HIPAA security standards and are a proper way to share client information. D. Incorrect. Using an approved EMR system is HIPAA compliant practice. Violating HIPAA can lead to legal consequences, including fines and loss of certification. Question 8. Professional conduct, dual relationships and ethical boundaries. NARBT works with a child whose parent offers to pay them extra money to provide therapy services outside of clinic hours. The LBT needs the extra income but is unsure if this is allowed. What is the best course of action? A. Accept the offer but keep the arrangement private to avoid conflict with the employer. B. Accept the offer only if the EBA supervisor approves of the additional work. C. Decline the offer and explain that providing private services to clients violates ethical guidelines. D. Accept the offer as long as no bad techniques are used, avoiding ethical concerns. Answer. C. Decline the offer and explain that providing private services to clients violates ethical guidelines. Explanation. This situation violates the BAC Code of Ethics, specifically regarding dual relationships and conflicts of interest. A. Incorrect. Keeping it private does not make it ethical. B. Incorrect. Even with BBA approval, this would still be an ethical violation. D. Incorrect. Avoiding bad techniques does not remove the conflict of interest, or ETS must maintain professional boundaries to avoid ethical conflicts and protect client welfare. Question 9. Behavior reduction, differential reinforcement strategies. E designs a behavior intervention plan (BIP) for a student who frequently engages in calling out in class. The BEBA recommends using differential reinforcement of other behavior (DRO) to reduce the behavior. How should the teacher correctly implement DRO in this scenario? A. Ignore the students calling out and only respond when they raise their hand. B. Provide reinforcement when the student refrains from calling out for specified interval of time. C. Reinforce the student for raising their hand and answering correctly. D. Remove attention completely when the student calls out and resume class without acknowledging them. Answer. B. Provide reinforcement when the student refrains from calling out for a specified interval of time. Explanation. Differential reinforcement of other behavior means providing reinforcement when the problem behavior does not occur during a set interval. In this case, the teacher would reinforce the absence of calling out after a predetermined time period. A. Incorrect. This describes differential reinforcement of alternative behavior not DRO. C. Incorrect. While raising hand is desired behavior, DRO focuses on the absence of the problem behavior, not on reinforcing an alternative behavior. D. Incorrect. Simply removing attention extinction without reinforcing appropriate behavior may not effectively reduce calling out. DRO is most effective when combined with clear reinforcement and gradually increasing the time interval for reinforcement. Question 10. Skill acquisition, prompting and fading strategies or BT is teaching a child how to tie their shoes using a most least prompting strategy. Which of the following describes how this technique should be correctly applied? A. Begin with minimal assistance and only provide help if the child struggles with a step. B. Start with full physical prompts and systematically fade them to less intrusive prompts as the child gains independence. C. Provide verbal instructions only and avoid using physical assistance. D. Alternate between full and partial prompts throughout the learning process to keep the child engaged. Answer. B. Start with full physical prompts and systematically fade them to less intrusive prompts as the child gains independence. Explanation. In most least prompting, the instructor starts with the highest level of support, e.g., full physical guidance, and gradually reduces the level of assistance as the learner demonstrates increased skill. A. Incorrect. This describes least to most prompting, not most to least. C. Incorrect. Verbal instructions alone may not be sufficient for learner who is new to the skill. D. Incorrect. Alternating prompts without structured fading plan can cause confusion. Proper prompt fading prevents prompt dependency and helps the learner develop independent skills. Question 11. Measurement, inter-observer agreement, and data reliability. 2 or ETS are assigned to collect frequency data on a client's hand-biting behavior during separate therapy sessions. After reviewing the data, the EBA notices significant differences between the 2 or ETS recordings. Which method should the EBA use to determine inter-observer agreement, IOA, and improve data reliability? A. Review video footage and have both or ETS take data again. B. Have both or ETS observe the behavior at the same time and compare their recorded data. C. Ask the ETS to justify their observations and keep the most experienced LBT's data. D. Average the 2 ETS recorded frequencies to create single dataset. Answer. B. Have both ETS observe the behavior at the same time and compare their recorded data. Explanation. Inter-observer agreement IOA measures the consistency of data collection between 2 or more observers. The best method to improve IOA is to have both ETS simultaneously observe and record the behavior, then compare their data. A. Incorrect. While reviewing footage can be useful, direct observation is a more practical method to assess agreement. C. Incorrect. IOA is based on objective comparison, not the experience level of the observer. D. Incorrect. Averaging the data does not ensure agreement or accuracy. High IOA score, e.g., 80% or higher, indicates strong reliability in data collection. Question 12. Behavior reduction, functional communication training. SE, a 6-year-old client frequently tantrums when denied access to their favorite toy. The BBA decides to use functional communication training, FET, to reduce tantrums. Which of the following best describes how FCT should be implemented? A. Teach the child an appropriate way to request the toy, such as using a communication card or saying, "Can I have it?" B. Remove access to the toy entirely until the child stops tantruming for several days. C. Give the toy immediately when the child begins to tantrum to reduce problem behavior. D. Ignore the tantrum and allow the child to self-regulate without intervention. Answer A. Teach the child an appropriate way to request the toy, such as using a communication card or saying, "Can I have it?" Explanation. Functional communication training, FET, is a behavior reduction strategy that teaches appropriate replacement behaviors that serve the same function as the problem behavior. B. Incorrect. Removing access entirely does not teach an alternative behavior. C. Incorrect. Giving the toy during tantrum reinforces problem behavior. D. Incorrect. Ignoring without teaching an alternative behavior does not promote skill development. FET effectively reduces problem behaviors by reinforcing appropriate communication methods instead. Question 13. Ethics, supervision requirements for OBTS. Now, BT is employed a private clinic and works with clients 30 hours per week. How many hours of supervision are required each month according to the back guidelines? A. At least 5% of total hours, meaning a minimum of 6 hours per month. B. At least 10% of total hours, meaning a minimum of 12 hours per month. C. At least 15% of total hours, meaning a minimum of 18 hours per month. D. Supervision is optional unless the BBA requests it. Answer A. At least 5% of total hours, meaning a minimum of 6 hours per month. Explanation. The BAC requires that ETS receive supervision for at least 5% of their total monthly hours providing ABAT services. For 30 hours per week, the OBT works 120 hours per month. 5% of 120 equals 6 hours of supervision per month. Supervision must include direct observation, feedback, training. B, C, and D incorrect. The BAC requires exactly 5% and supervision is mandatory. Regular supervision ensures competency, ethical compliance, and professional development. Question 14. Ethics, dual relationships, and professional boundaries. A parent invites their child's OBT to a family birthday party as a thank you for their hard work. The OBT enjoys working with the family and wants to maintain a good relationship. What is the most ethical response? A. Politely decline the invitation and explain that attending would be a conflict of interest. B. Attend the party but avoid discussing the client or about therapy. C. Accept the invitation only if the BEBA also approves of attending. D. Accept the invitation and keep it confidential to avoid any concerns. Answer A. Politely decline the invitation and explain that attending would be a conflict of interest. Explanation. Attending a social event with a client's family creates dual relationship, which is prohibited by the BAC Code of Ethics. B, C, and D incorrect. Even if ABAT is not discussed, it still blurs professional boundaries. Maintaining clear professional boundaries ensures objectivity and protects the therapeutic relationship. Question 15. Behavior reduction, extinction procedures. A EE working with a 7-year-old client who engages in screaming whenever they are denied access to a preferred toy. The BEA implements an extinction procedure to reduce this behavior. Which of the following best describes how extinction should be applied in this situation? A. Completely ignore the screaming and withhold access to the toy until the child stops. B. Give the toy immediately when the child starts screaming to calm them down. C. Remove all toys from the environment to prevent the behavior from occurring. D. Allow access to the toy after a delay even if the child continues to scream. Answer A. Completely ignore the screaming and withhold access to the toy until the child stops. Explanation. Extinction involves removing the reinforcement that previously maintained the behavior. If screaming was reinforced by getting access to a toy, extinction means not providing the toy when the screaming occurs. B. Incorrect. Giving the toy reinforces screaming, making the behavior more likely. C. Incorrect. Removing all toys does not. Appropriate behavior. D. Incorrect. Delayed reinforcement still strengthens the problem behavior. Extinction can cause temporary increase in behavior. Extinction burst before it decreases. Question 16. Skill acquisition, discrete trial training. A behavior analyst is using discrete trial training DE to teach a child how to identify colors. Which of the following best represents the correct implementation of DET? A. Presenting the color red and immediately providing reinforcement regardless of the child's response. B. Asking what color is this? Providing prompt if needed, reinforcing correct responses and repeating the trial. C. Waiting for the child to point to color on their own before providing any reinforcement. D. Randomly presenting colors and only reinforcing correct responses some of the time. Answer B. Asking what color is this? Providing prompt if needed, reinforcing correct responses and repeating the trial. Explanation. EET consists of 3 key components: discriminative stimulus SD, the instruction e.g. what color is this? Response, the child's answer. Consequence, reinforcement for correct responses or prompting for incorrect responses. A. Incorrect. Reinforcement should be contingent on correct response. C. Incorrect. Waiting for spontaneous responses does not follow the structured approach of EET. D. Incorrect. Reinforcement should be consistent at first, then faded over time. DET is highly structured and effective for teaching new skills systematically. Question 17. Measurement, partial versus whole interval recording. A teacher wants to measure how often a student stays on task during a 30-minute lesson. The BEBA recommends using whole interval recording. How should the teacher correctly implement this data collection method? A. Mark an interval as on task only if the student remains on task for the entire duration. B. Mark an interval as on task if the student is on task at any point during the interval. C. Record whether the student was on task at the end of each interval. D. Count the total number of times the student engaged in on-task behavior. Answer A. Mark an interval as on task only if the student remains on task for the entire duration. Explanation. Whole interval recording requires that the behavior must occur for the entire interval to be recorded as positive instance. B. Incorrect. This describes partial interval recording, which marks the behavior if it occurs at any point in the interval. C. Incorrect. This describes momentary time sampling, which records the behavior only at the end of an interval. D. Incorrect. Counting occurrences is event recording, not interval recording. Whole interval recording is useful for measuring continuous behaviors, but it can underestimate behavior. Question 18. Ethics, dual relationships, and gift acceptance. A client's parent gives an RBT $50 gift card as holiday gift to show appreciation. The RBT appreciates the gesture but is unsure if they should accept it. What is the most ethical course of action? A. Politely decline the gift and explain that accepting gifts violates ethical guidelines. B. Accept the gift but inform the BBA so it can be documented. C. Accept the gift since it does not impact clinical decisions. D. Accept the gift only if it is below $10. Answer A. Politely decline the gift and explain that accepting gifts violates ethical guidelines. Explanation. According to the BAC Code of Ethic, our ETS must not accept gifts from clients or families as it can create a dual relationship and affect professional boundaries. B, C, and D incorrect. Accepting gifts, regardless of the amount, can compromise objectivity. The OBT should thank the parent and explain the ethical guidelines. Maintain professionalism. Question 19. Behavior of reduction, escape maintained behavior. A student frequently runs out of the classroom when presented with a difficult math worksheet. The BBA determines that the behavior is escape maintained. Which intervention is most appropriate? A. Allow the student to leave the room whenever they feel frustrated. B. Require the student to complete some of the worksheet before allowing a break. C. Ignore the behavior and continue the lesson. D. Physically block the student from leaving without providing an alternative. Answer B. Require the student to complete some of the worksheet before allowing a break. Explanation. Escape maintained behavior occurs when a child engages in problem behavior to avoid a task. The best strategy is demand fading or escape extinction, where the child learns that completing work leads to a break. A. Incorrect. Allowing escape reinforces the behavior. C. Incorrect. Ignoring does not address the function of the behavior. D. Incorrect. Blocking escape without offering an alternative does not teach replacement skill. The student should learn that task completion leads to reinforcement. E.g. breaks. Question 20. Skill acquisition, generalization, and maintenance. A client has learned to identify objects in therapy but struggles to do so at home. The BBA wants to promote generalization of this skill. Which strategy would be most effective? A. Use the same materials in all settings to reinforce consistency. B. Train the skill across different people, settings, and materials. C. Only reinforce the skill in therapy to avoid confusion. D. Allow the client to decide when they want to practice the skill. Correct answer. B. Train the skill across different people, settings, and materials. Explanation. Generalization occurs when a skill is applied outside of training conditions. To promote generalization, the skill should be practiced in different environments: home, school, community, taught with varied materials, different toys, flashcards, reinforced by multiple people, parents, teachers, therapists. A, C, and D incorrect. Restricting training to single setting prevents generalization. By varying stimuli and environments, the client learns to apply skills in real-world situations. Question 21. Preference assessments. A E working with a 6-year-old child and wants to determine which items function as reinforcers. The EBA decides to use a pet stimulus preference assessment to identify the child's preferred toys. Which of the following best describes how this assessment should be conducted? A. Present 2 items at a time and ask the child to choose one, repeating this process with all items in systematic manner. B. Allow the child to play freely with all available items and record which items they engage with the most. C. Give the child access to each item one at a time and measure how long they engage with each item. D. Observe the child in natural environment and note which items they interact with without interference. Answer A. Present two items at a time and ask the child to choose one, repeating this process with all items in a systematic manner. Explanation. A paired stimulus preference assessment involves presenting two items at a time and recording which one the child selects. This method provides a hierarchy of preferences based on choices made across multiple trials. B. Incorrect. This describes free operant preference assessment which does not ranked preference list. C. Incorrect. This describes single stimulus assessment, which is useful for children with difficulty making choices. D. Incorrect. This describes naturalistic observation, which lacks systematic control. Paired stimulus assessments are effective for identifying strong reinforcers that can be used in skill acquisition programs. Question 22. Functional communication training (SE). A child frequently screams to get attention from their teacher. The BEA implements functional communication training (FCT) to teach the child to request attention appropriately. Which of the following best describes how FET should be implemented? A. Ignore the child's screaming entirely and wait for them to stop. B. Teach the child an alternative way to request attention. E.g., raising their hand and reinforce it consistently. C. Provide attention every time the child screams to reduce their frustration. D. Punish the child for screaming by removing them from the classroom. Answer B. Teach the child an alternative way to request attention. E.g., raising their hand and reinforce it consistently. Explanation. FCT replaces problem behavior with an appropriate, functionally equivalent alternative. The child should be prompted to use the new skill and reinforced immediately when they do. A. Incorrect. Ignoring alone does not teach replacement behavior. C. Incorrect. Reinforcing screaming increases the problem behavior. D. Incorrect. Punishment without teaching an alternative behavior is not an effective long-term solution. FET is most effective when reinforcement is provided more consistently for the replacement behavior than for the problem behavior. Question 23. Differential reinforcement of alternative behavior. Draw E. Working with a child who hits others to get access to toys. The BBA decides to use differential reinforcement of alternative behavior. Draw to address the issue. Which of the following would be the best approach? A. Ignore the hitting and only reinforce when the child asks appropriately for a toy. B. Give the child a toy every time they hit to prevent further aggression. C. Remove all toys from the environment to eliminate the need for sharing. D. Punish the child for hitting by taking away a preferred toy. Answer A. Ignore the hitting and only reinforce when the child asks appropriately for a toy. Explanation. Draw involves reinforcing an appropriate behavior, e.g., asking for a toy while withholding reinforcement for the problem behavior. Hitting. B. Incorrect. Reinforcing hitting strengthens the behavior. C. Incorrect. Removing toys does not teach the appropriate behavior. D. Incorrect. Punishment alone does not encourage positive alternatives. Draw helps the child learn effective communication and social skills instead of engaging in aggression. Question 24. Token economy. E. Designing a token economy system for a classroom of students with autism. The students will earn tokens for following classroom rules and can exchange them for rewards. Which of the following is a key component of a successful token economy? A. Providing tokens at random to increase motivation. B. Allowing students to decide when they want to exchange their tokens. C. Clearly defining target behaviors, token values, and available rewards. D. Giving students a token only at the end of the school day to avoid distraction. Answer C. Clearly defining target behaviors, token values, and available rewards. Explanation. A successful token economy requires clearly defined target behaviors, what earns token, consistent reinforcement, when and how a token's delivered, exchangeable reinforcers, what can tokens be traded for? A. Incorrect. Tokens should be earned predictably, not randomly. B. Incorrect. Clear rules must be in place for when tokens can be exchanged. D. Incorrect. Immediate reinforcement is often more effective. Token economies are highly effective for increasing desired behaviors in structured environments. Question 25. Contingency contracts. E case, a contingency contract with a teenager who frequently refuses to complete homework. The contract states that if the teenager completes all assigned homework for a week, they will earn extra gaming time on the weekend. Which principle makes this contract effective? A. The agreement is mutually negotiated and specifies clear expectations. B. The consequence is delivered regardless of the teen's behavior. C. The contract focuses on past behavior instead of future improvements. D. The consequence is applied randomly to keep the teen engaged. Answer A. The agreement is mutually negotiated and specifies clear expectations. Explanation: a contingency contract is effective when both parties agree to the terms, expectations are clearly defined. E.g., what the student must do. Reinforcement is contingent on meeting the agreement. B. Incorrect. The consequence should only occur if the contract is met. C. Incorrect. The contract should focus on future behavior. D. Incorrect. Random consequences do not teach responsibility. Contingency contracts help increase accountability and motivation for behavior change. Question 26. Antecedent interventions. A student frequently talks out of turn during group discussions. The BBA recommends antecedent interventions to reduce the behavior. Which of the following is an example of an antecedent intervention? A. Teaching the student to raise their hand before speaking. B. Giving the student a timeout after speaking out of turn. C. Ignoring the student until they stop speaking out of turn. D. Removing the student from the discussion group. Answer A. Teaching the student to raise their hand before speaking. Explanation: antecedent interventions modify the environment to prevent problem behaviors before they occur. Teaching replacement behaviors, e.g., hand raising, is an effective approach. B. Incorrect. Timeouts are consequences, not antecedents. C. Incorrect. Ignoring does not address the antecedent triggers. D. Incorrect. Removing the student does not teach appropriate. Antecedent strategies help create proactive behavior support plans. Question 27. Extinction procedures. A 10-year-old student frequently engages in tantrums when denied access to a preferred activity. The teacher, following AIA's recommendation, implements extinction to reduce the behavior. Which of the following describes the correct way to implement an extinction procedure in this scenario? A. Ignore the tantrum and do not provide access to the preferred activity. B. Give the student access to the activity to calm them down. C. Punish the student for tantrums by removing privileges. D. Remove the preferred activity from the classroom altogether. Answer A. Ignore the tantrum and do not provide access to the preferred activity. Explanation: extinction involves withholding reinforcement that was previously maintaining the behavior. In this case, if the student's tantrums were reinforced by gaining access to the activity, extinction means ensuring that tantrums never result in access to that activity. B. Incorrect. Providing the activity reinforces the tantrum. C. Incorrect. Punishment is not the same. Extinction. D. Incorrect. Removing the activity entirely does not teach appropriate behavior. Extinction often leads to temporary increase in behavior. Extinction burst before decrease occurs. Consistency is key to success. Question 20. Behavioral momentum. A child often refuses to follow instructions when asked to complete a difficult task, e.g., writing their name. The BEA decides to use behavioral momentum to increase compliance. How should the BEA apply this strategy? A. Start with several easy tasks the child is likely to complete, then present the difficult task. B. Give the child a break before presenting the difficult task. C. Ignore the child's refusal and wait for them to comply. D. Give the difficult task first to establish expectations. Answer A. Start with several easy tasks the child is likely to complete, then present the difficult task. Explanation: behavioral momentum involves presenting a series of easy tasks, high probability requests before introducing a more difficult task, low probability request. This approach builds compliance momentum, making it more likely the child will follow the difficult instruction. B. Incorrect. Taking break may not increase compliance. E. Correct. Ignoring does not increase the likelihood of compliance. D. Incorrect. Difficult task first may lead to immediate refusal. Behavioral momentum is proven strategy for increasing compliance in various settings. Question 29. Generalization of skills. Teaches a child to greet peers by saying hello during structured social skills session. However, the child only says hello in the therapy room and does not generalize the skill to other settings. Which of the following strategies would best promote generalization of this skill? A. Practice greetings in multiple environments and with different people. B. Continue practicing only in the therapy room until mastery is achieved. C. Reinforce the child only when they greet the therapist. D. Stop teaching greetings, assuming the child will generalize over time. Answer A. Practice greetings in multiple environments and with different people. Explanation. Generalization occurs when a skill transfers across different settings, people, and stimuli. To promote generalization, the EEBA should teach in multiple environments, e.g. home, school, community, use different people, e.g. peers, teachers, family members, vary prompts and reinforcement to prevent reliance on one specific cue. Incorrect. Practicing only in one setting limits generalization. C. Incorrect. Reinforcing only specific instances discourages flexibility. D. Incorrect. Generalization does not always happen automatically. Promoting generalization ensures that skills are functional in real-world settings. Question 30. Ethical use of reinforcement. A EE working with a nonverbal child who enjoys watching YouTube videos. The BEA decides to use access to YouTube as reinforcement for correctly using a communication device. Which of the following considerations is most important when using this reinforcement? A. Ensuring the reinforcement is ethically appropriate and does not cause harm. B. Providing access to YouTube at random times to maintain motivation. C. Allowing unlimited access to YouTube to avoid frustration. D. Removing YouTube entirely if the child does not use the device. Answer A. Ensuring the reinforcement is ethically appropriate and does not cause harm. Explanation. Ethical reinforcement practices ensure the reinforcer is appropriate, e.g., not harmful or overly restrictive. The child is not deprived of essential needs. Reinforcement is used consistently and systematically to promote skill acquisition. B. Incorrect. Reinforcement should be contingent, not random. C. Incorrect. Unlimited access reduces effectiveness of reinforcement. D. Incorrect. Completely removing reinforcement may reduce motivation. Ethical considerations ensure reinforcement supports learning and well-being without unintended harm.